I get a lot of questions about recovery after a tummy tuck, and I must say that it really depends on what the patient asking the question means by recovery. So I don't know how long your recovery will be unless I know what activity you're talking about. If you want to be able to get up and go back to work, well, what do you do for a living? If you work at Dunkin' Donuts or as an auto mechanic, your recovery and your needed necessary time at home is going to be very different from, say, someone who works at a desk job. So I put together here some pictures of a patient from another video that I think may help people to understand, number one, again, what goes on with a tummy tuck, and number two, what her recovery was like. Looking at the patient over here on the left, certainly her tummy is rotund. She did have a hernia here, which we repaired in the operating room. And if you saw the other video, you'll know that all of the skin between the belly button and the bikini line was removed. Now, this next photograph may help to explain that even better. Again, her belly button is over here someplace, and the black line is where I made my incision. That means that all of the skin between this black line and the belly button was removed, and then the skin from the upper belly was pulled down to cover the open area. So what made me draw this line right here? Well, the red dotted line is exactly where her panties fit, if you look again at the pre-op photo, or in fact even at the post-op photo. You can see that her bikini line, or in this case her panties, will cover the scar post-operatively. Once again, this is not her final result. This is her at only 5 weeks. Now, 5 weeks later, she certainly is feeling much better, and this woman certainly was back at work. But she had a job that was not terribly labor-intensive, although she was on her feet. Interestingly, in this case, you might note that her skin marks, say the little freckle here, it does actually get moved down a little bit, down below the rib. And some of the other marks as well start to shift from areas up in this region, maybe down to the mid-abdomen. So I've now put up pictures of this same patient 3 months into her recovery. And you can see that the swelling in her lower abdomen is certainly going down dramatically. And frankly, in most circumstances, I tell my patients 3 months and you're just about done. Usually by 3 months, the vast majority of the swelling is gone. I'd like to point out again some of her landmarks. If you look at some of her freckles in this area, they are now shifted down a little bit in her tummy because the skin was removed. But for the sake of the people who, several people who have told me that these results are not believable and we're not sure it's the same patient, if you look at some of the markings on her thighs, you'll see them in both pictures. Also behind the axilla here, they're present in all 3 photographs that are up there. In any case, moving on with her recovery. Her tummy is flatter, but honestly, at 6 months, I think it's flatter still. And she looks even better than she did at 3 months. And that's because we know that physiologically, human beings will hold on to a certain amount of fluid for a long while post-operatively. The last thing I'll show you is a close-up of her scar about 2 years afterwards. And if you look closely, there is a scar, a white line that comes across her tummy like so. And again, she needed to pull her panties down in order to show this line to me. And you can also see that there's a small scar under the belly button. The rest of the scar is, well, most of it is covered by a little skin fold. And the only real scar on the skin is right here below. So lastly, I want to remind everyone that recovery from a tummy tuck is a funny thing. I tell most patients who are on their feet, you're going to need somewhere between 2 and 3 weeks post-operatively before you're really back on your feet again. You'll still be a little sore, but you'll be getting around. I also tell patients, because they've told me in the past, that the operation surprisingly is not terribly painful. Patients tell me I feel awful, I feel terrible, I feel like I got hit by a truck. But I rarely hear them say, I've got pain, or can I have some more pain medicine? It's a very interesting scenario that gets played out. Again, I hope that this video is helpful to you. I hope that I've demonstrated how the procedure is performed and perhaps persuaded some of you that it is safe and certainly effective.